Hi, I'm Jennifer Jackson. I'm an assistant professor at the University of Calgary in the Faculty of Nursing and a registered nurse. And today we're going to talk about qualitative research designs. So what is qualitative research and how does it fit into a general overview of what nursing research is and what specifically are some of these designs? So we're going to look at the main qualitative methodologies, and after this lecture, you are not expected to be able to do qualitative research. What we're hoping for is that you can recognize and distinguish different types of qualitative research. So this is a sampler to introduce you to what's out there and to build upon your knowledge relating to what different kinds of research can look like. So if you're in my course, we've looked at qualitative and quantitative research. So last week we focused on what quantitative research looks like. So we study, as the name suggests, quantities. We look at large groups, we look at trends, and using experimental designs, testing hypotheses, and these types of things. So quantitative research is essential in health research. And qualitative research is a different part that complements this. So it's not a question of one kind of research is better or worse, or if you ever hear those types of narratives, like that isn't worth buying into. Qual and Quant cover different things, both of which are essential for nurses and for the work that we do. And in reality, most studies these days are some degree of mixed methods anyway. So we teach them separately so that it's a little bit easier to wrap your head around, but know that there isn't a value hierarchy here. It's just that these are for two specifically different purposes. So I've talked a bit about what we use quantitative research for. With qualitative research, we are, as the name suggests again, we are studying the quality of something. So you can have two people with the same diagnosis, the same age, the same gender, and they can have completely different experiences of that phenomenon that they're experiencing. So what we want to do is understand those specific experiences, and we do that by engaging in small groups that we select very purposefully, rather than just say, how does everybody in one area feel about this type of thing? So it's a different approach to help us understand what something is like, rather than just what is happening. So these two things go together and help in terms of qualitative and quantitative research, and they help give us an overall understanding of not only how a phenomenon behaves, but also what it's like to experience it. So qualitative research wades into the messiness. Qualitative research looks at what is it like to go through these things, and what is that really visceral kind of human experience. So it's not about like, is your cancer in remission, yes or no? It's about what is that experience and how did you feel and what helped you and how do people react, and all of these different kinds of questions that can give us information to help provide better care and just make better sense of the human condition. So we're going to talk a little bit about methodology versus methods before we get into specific qualitative work. So methodology and methods overlaps a bit with quantitative work, but this is very foundational for research, so I'm going to go through it again here. So methodology refers to the overall approach, whereas methods is the specific tools or techniques that you use. So these terms are not interchangeable and they mean different things. So for example, your methodology could be classical music and your methods could be, you know, a violin, an oboe, or any other kind of instrument. So the question becomes, well, which methodology and which methods do I use? These things are all like interlocking pieces or interlocking puzzle pieces, that align with your ontology and epistemology. And there's a separate video that refers to those concepts, but you have to see these things as all fitting together. So when you are praising research, one of the main things you're doing is looking for that fit between the approach that is chosen and the techniques that are used. For example, if you wanted to say, my overall methodology is classical music, but my methods are the electric guitar, I mean, anything's possible, but you would probably have to hold on and say, hold on a second, is that really what you want? So looking for that fit between methodology and methods gives us information about, is this research done well, and does this person know what they are doing as they planned this study? And in some cases you can say, oh, okay, they've done something a little bit different here, but they've explained very well why they've done that, and so it allows us to try something a bit different. So that's just a note on methodology and methods. So you'll need to be very clear on separating those two things as we go through, because we're going to talk about qualitative methodologies and the methods they use, and we need to keep those separate. So before I talk about the specific methodologies in more detail, I'm going to talk overall about some general principles of qualitative research. So no matter kind of what variant of music you're listening to, whether it's, you know, Mozart, Beethoven, or Bach, you can say, okay, well, generally I expect to hear string instruments, and generally there will be a conductor, and some of these kinds of things. So that can help you have like a working model in your mind of what qualitative research should be, and then, you know, you can appreciate the artistic quality to extend the music metaphor of like each different composer. But it's a generally understanding that when I see these things in a paper, this is a cue, it's qualitative research. Or like when I see these things in front of me, this is a cue that I am at the symphony and not at a rock concert. Okay, so looking at, let me just get the slides to go here. So one of the things that's distinct in qualitative studies is sampling. So sampling is how we find the people to participate in our research. And we use the term participate very deliberately because people in a qualitative type of space, we understand that people participate and essentially work with us to create new understandings and create new knowledge. So it's not us going and like extracting information from someone. What we're doing is understanding someone's experience and working with them to generate new understanding, create new ideas, learn about an experience, all of those things. So it's not about you kind of strip mine and leave, it's about how do we work together to build something. So sampling is how we find the right people to help us with this process. So if you're sampling in a quantitative study, you're probably going to want like a cross-section of society to say, you know, how did these 1,000 nurses respond to this issue? With qualitative studies, you want a very few people generally, but you want people who are experts in what you're talking about. So what is it like to be a nurse with a disability? Or what is it like to be a nurse and a single parent? Or, you know, what is the transition from being a student nurse to being a qualified registered nurse? So you're going to find people that have specifically lived that thing that you are talking about. So that's why we call it purposive sampling, or it has a purpose. So you're finding people that are experts in the thing that you want to talk about. Or it might be you, depending on what kind of research you're using, you're finding a scenario or a ward or a space, or you're finding an area where the people are experts in that issue. And experts doesn't necessarily mean they have graduate degrees or anything. Experts means they are somebody who has lived it. So in qualitative studies, you'll often also see convenience sampling because you do need people who are practically available. You know, the person who might be the world expert in what it is like to have cancer while you have 6 children might be the, you know, someone who lives in China, and that person is not practically available. So maybe you'll find other people here in Canada that have cancer and have multiple children, and what that experience is like. So you do want to find people who are experts in the thing you're looking for, but there's an element of practicality, which is where we get convenience sampling. Another term you may hear is snowball sampling, and that gets people to refer from one participant to another. So very much like a snowball grows as it rolls, down a hill or something like that. That concept is that, we talk to two nurses about their experiences and then say, who else do you think I should talk to? Can you tell me about someone else that would know about this issue? Or can you get them to call me and so I can speak to other people? So it's sort of a referral system. And that is a really good way of moving from the first participants in your study on to participants later on. So these are all different ways we think about how we recruit people to qualitative studies. The actual techniques that we use might be similar to quantitative studies, i.e. we put up a poster or we create a website, share some posts on social media. But the idea is that with qualitative studies, we're going to be a lot more specific about who we want to connect with. There's a lot of debate in qualitative research about how many people do we need. So there's a concept of saturation, which means that we have learned everything we can learn about this topic. So we go until our data is saturated, meaning we know everything we can know about it. In reality, I think on some level, some researchers will also argue that saturation is impossible because we have infinite human experiences. There are technically infinite possibilities of how someone could experience something. So it's never, I don't think it's ever possible to explain an entire phenomenon from talking to, 10 or 15 or even 30 people. But then that's not also the purpose of research. Knowing that we're a practice discipline and we want to improve healthcare, chasing endlessly to find every version of one story is not necessarily helping us. So the concept of saturation, pragmatically applied, can mean how many people do we need to talk to until we know the story of this experience? And for example, if you're doing interviews and you start to hear the same things over and over again, you might start to think, okay, I have reached a point of saturation where from the people I have talked to, I found everything I need to know. So this is not like in quantitative research where you can do a power calculation and say, okay, we need to interview or have, minimum of 200 people complete the survey. It's a little bit more murky in qualitative work, but just know that it's something that if you're reading a study, they need to address how many people they used and how they decided that that was the right number of people to be a part of this study. And when you're in graduate school, you can learn more about this and we can take this conversation further. So that was how we get our participants for the study. Now, this is how we actually participate with them and create the new knowledge. We do that through data collection. Sometimes it's called data generation or data creation, but generally data collection is kind of the standard understanding. In qualitative research, there's mainly 3 ways of collecting data. Talk to someone, watch someone, or look at things. That's a broad oversimplification, but generally that's what it boils down to. So when we say talk to someone, we mean interviewing, focus groups. There's lots of different ways you can do this, but it's generally to ask people questions about their experiences. So this is good if you want to understand someone's experience or what it was like to go through a process, and whether you're looking at perceptions, experiences, understandings, those kinds of things. When you want to know a bit about what's going on inside someone's head, then you want to use an interview or talking type of technique to generate data that way. if you want to understand what a culture is like or how a process works, you might choose to use observation, which is essentially watching people. So observation works when you don't necessarily want to know as much about what's going on in someone's head, but rather how something is playing out in real life. So when we talk about observing a culture, it doesn't necessarily mean, you know, going and observing an indigenous community in Brazilian rainforest. Although it has meant that, that is not the only idea. You can have the culture in a nursing unit. You can have a culture in an office. You can have a culture in a classroom. So you might be observing culture at that level too. You can have both participant and non-participant observation. Participant means you are a part of what is going on. So if everybody goes on a fire drill, you go on a fire drill. If everyone takes notes during the lecture, you take notes during the lecture. What you're doing is like living the experience of being a nursing student or being, you know, a nurse on a ward or something like that. If you have non-participant observation, you are sitting back and you're not participating in what's happening, but you are still watching. So non-participant observation can occur at something like a safe injection site. We don't necessarily want to send a researcher who's going to go use drugs, but they can watch what's happening in that environment. So there's different types of observation and it can have lots of different flavors, but that's kind of a general. It's more when you want to see how something occurs or what a culture is like, rather than sort of what's going on in someone's mind. Finally, we can also do qualitative research with text or with images. So these can be things that already exist. So for example, you could look at how journalists have written about nurses in newspapers, or you know, how comments to a Facebook post reflect different attitudes towards nursing or something like that. So these can be things that already exist. You can also get participants to create things for you. For example, you can give someone a camera and say, take a picture of something that gives you hope. And then they bring the picture back and talk with you about the picture and why does that picture represent something that gives you hope. And I have seen a study like that with people who have mental illness, and they talk about how the process of seeking a visual about hope, what that means to them. So in that way, you can use lots of different things that are like text, images, objects, all kinds of things that are very tactile. And you can either have people create them or you can find them and use them yourself. So before you would do any of this, you would need ethical approval as well, which we talk about in another lecture. But these, when you're seeing some type of qualitative research, you're probably going to see one of these types of data collection associated with that. And then in qualitative research, there is a specific sort of flavor to the data analysis. And there's lots of different kinds of qualitative data analysis. And just a little note to say that this is where the skill of being a nurse researcher really comes into play, because in a clinical setting, you can know the difference between morphine, ibuprofen, acetaminophen, fentanyl, ketamine, and you know when to use each one and why you need to use each one and what they do and what you can expect and all of those kinds of things. For data analysis, we have similarly sophisticated types of analysis. So we can do content analysis, discourse analysis, thematic analysis, all kinds of different types of analyses. And knowing when to use which one is just as skilled and just as sophisticated as knowing like when to give morphine, when to give acetaminophen, and when to give fentanyl. So you're not expected to know, at an undergraduate level, you're not expected to know what all of these are, but just understand that there are different kinds and that it is an advanced type of knowledge to know when to apply each different technique. And so if someone says, oh, people who do research are not real nurses anymore, actually, we're using very sophisticated knowledge. It's just being applied in a different way. So generally, when you do data analysis, you're working with text. There are exceptions to that, but the mainstay is working with text. So I'll just give you a moment. This is a quote from one of my participants in a study I did, and this part was looking at, what is your view of your identity as a nurse? So we might take this sample of text and want to highlight the key ideas that we see in it. Because what we're going to do is hold, from 10 interviews, we've got 10 different sets of text. We'll highlight the key ideas in each one and then see where those key ideas overlap. So what data analysis with qualitative work might look like is something like this. So you go through and highlight the different areas that you think are really critical. And this isn't something you do just once. You go through it and through it and through it and find, oh, I missed this or I included this, but this isn't that important. And so it's a process of identifying the really important little golden nuggets in those interviews and then making sense out of them. So data analysis can also look like this. This is from my master's. So in trying to understand a process, I think I have several notebooks that are full of just scribble pages and trying to get different things out and sort out how I understood experiences and how each new participant was helping me frame my knowledge. So you can use, there is software that can help you organize your data, but I think everyone who does qualitative research has a very sophisticated set of Post-it notes and colored markers, and sometimes you have to just scribble some things out. So this is different from quantitative data analysis, where you have to make sure you have very high levels of precision in putting your data, but then you can run some tests and get the answer. With qualitative work, in some cases there is no answer, but you have to really work through it to get to an understanding. So generally, quantitative research tends to be a bit top heavy, like the first parts of the study are a little bit more involved, and then it's a little lighter towards the end, whereas with qualitative analysis, it's the reverse of that. The analysis is the heavy part, and the end part of the study tends to be more involved. So it's just depending on what data analysis and data collection techniques you use, that depends on how the rest of the process of the study goes and how you're able to create new knowledge. Okay, so those are looking at some general principles of how we manage data, how we collect data, how we find people to talk to. All of those things roughly apply to all of the different methodologies in qualitative research. So just a reminder that methodologies are like the broad types of research, and now we're going to go through the main ones in qualitative work. So qualitative research generally includes phenomenology, grounded theory, ethnography, case studies, and interpretive description. There's probably 20 more kinds that we haven't included here, but these are the basic ones. And what I want you to be able to do is recognize one from another or distinguish one from another. And you don't have to be able to do this just spontaneously, but if you're reading an abstract and you have your notes with you, look through and say, what kind of research are they using, and what methodology is this, and how is it different from others? So how do I know this is classical music, and how do I know this is like rock or pop? How do I tell those differences? So I'm going to walk you through each one of these types of research, and then at the end we will contrast them so that you can see how they differ from one another. So phenomenology, what we are doing is exactly as the name implies, studying a phenomenon. So what we want to do is know about the experience of something. So phenomenology is about experience. So we want to know not just like, did this make you happy or did this make you sad, but like how did this process change your life or change your understanding about something? This is a very deep kind of analysis, not superficial. So we want to know how an experience relates to you as a person and what it was like to deal with something. So questions that we might see in phenomenology are something like, what is it like to go from being an undergraduate nurse to being a qualified registered nurse? Or what is it like to understand research as a student nurse? How do we understand the experience of implementing research evidence into clinical practice? So the focus of phenomenology is on experience. And here's an example. Some of the studies I'm going to refer to are a bit older, but the idea is that they are really good crystallized examples. So let's not focus too much on the fact that this study is from 1997, for example. So these researchers wanted to do a phenomenology of nurses' humor. So what they did was come up with themes around how nurses experience and use humor. So they found that there was therapeutic communication. They could deal with difficult situations. They could either plan to use humor or it could just be spontaneous. And it had an effect both immediately, but also lasting with the therapeutic relationship. And it could create a sense of cohesiveness among nurses, but also among nurses and patients. So this example of phenomenology shows that they studied the experience of using humor and what that is like, and they came up with 5 core ideas. Now, these core ideas, or these themes, they're all connected and they're related to each other, but they do not directly, one doesn't affect another in the sense of like you knock one domino over, it doesn't knock over the others. So these are kind of 5 standalone themes. And that becomes important when we talk about our next method. But yes, phenomenology, we understand an experience and we find different themes that explain that experience and describe what it is like. So when we move from phenomenology to grounded theory, we are doing something different. We are looking at what is the process of how a thing happens. So grounded theory is about creating a new theory based on evidence. And from that evidence, from say interviews with people, you create a theory that explains how something happens. Then you can, apply and test this theory, but that happens separately. So this is the first step of creating a theory, and it's very bottom up or like kind of grassroots creation of theory. And then this can be used to inform policy and practice. And if we say, this is the experience of how nurses are transitioning from being students to being independent practitioners, then we can modify this process by putting in different interventions. So the main thing with grounded theory, what really separates grounded theory from other types of research is the predictive capacity. So if something is a grounded theory and it's done properly, it gives you predictive capacity. So you can look at where someone is and predict what is going to happen with a reasonable degree of accuracy. And that is the main factor that separates grounded theory from all other types of studies, but especially from phenomenology. So the people who really understand this know that with grounded theory, you need that predictive capacity, whereas with phenomenology, you don't. So what does this mean? So this is the grounded theory that I wrote in my master's, and what I did was look at how are nurses managing their exposure to workplace adversity. So something bad happens at work. How do nurses deal with it? And here you can see that this is a process. The visual implies motion, that you move through different stages. So that reflects the process nature of grounded theory. And also we start with a problem, and then we have situational awareness. Now this is where the predictive capacity comes in, is that I could say if a nurse experiences something bad at work and they have an awareness of how it is affecting them, they are going to be able to cope. They may be able to cope well, they may not be able to cope well. But if they are aware that something is happening to them or they recognize that, then they're going to be able to enact different behaviors that will help them cope. If they do not have that awareness, they are going to end up burnt out. So based on whether someone had awareness or not, I could then predict, are they going to be able to cope with difficulty at work? Yes or no? Now that's not, I can't predict, use a crystal ball and predict the future, but you could say with a reasonable degree of certainty what is going to happen if people are not having an awareness of how they're being impacted. So then one of the interventions from this is to increase awareness and support the awareness among nurses. Because if we do that, then we can change the pathway someone will take through this experience. So hopefully not getting too complicated here, but just to know that grounded theory looks at a process, and that element of predictive capacity is what sets grounded theory apart. So unlike phenomenology, that previous diagram we had, all of these pieces are directly connected together, and they're essentially like, knock one domino over, all the others will knock over as well. So that is also a hallmark of grounded theory, is that it's not just a bunch of separate ideas, it's everything is all meshed together. Okay, so we've looked at phenomenology, which gives us experience. We've looked at grounded theory, which gives us process. And now we're going to ethnography, which gives us culture. So ethnography essentially answers the question, what is it like here? And what does it mean to be in this culture and in this environment and in this situation? So it is important to say that ethnography definitely has a colonial history, and it has been used in some not very nice ways in the past. Sort of like having white Europeans who said, let's go see what the savages' culture is like. And so, we'll go and do cultural studies in different colonies and look at how these primitive peoples understand their world. Of course, those peoples were not primitive at all. They had very sophisticated systems of governance and understandings of science and nature and all kinds of things. But when that colonial lens was applied, they were looking for, their own version of culture being reproduced as the correct one. So just to know that I wouldn't want anyone to use an ethnographic method without being aware of that legacy of colonialism and how that has shaped how ethnography is used. Now, having said that, ethnography is still very, very valuable today. And that is for a few different reasons. We know in research, if you ask someone about something, what they tell you may not be the whole story. And it's not because they're lying to you or they don't know what's going on, but sometimes there are factors at play like power, like privilege, and those aren't always easy for an individual person to articulate how that happens across the system. So what ethnography can do is explain, what is the culture at the nursing desk and what role does the nursing desk serve when you have nurses and doctors and allied healthcare professionals connecting together? How does that all relate? And by observing, you can see something a bit different than if you were speaking to individuals out of their context. So you can have different types of ethnography, and there's different flavors within it. Some can be very specific, so looking at what is the culture around inserting an NG tube. So that might be a really good study to do if there have been, critical incidents where NG tubes in an organization have been inserted incorrectly. Well, can we have a really focused ethnography and say, how are NG tubes being inserted? What's going on? What is this process like? And then come to understand, actually the policy isn't adequate, or, the equipment isn't available on the ward, so people can't follow the policy. It helps us to dig out some of those really sticky issues that it's hard to trace otherwise. So the hallmark of ethnography is either participant or non-participant observation. You touched on this a little bit earlier, but just to say that participant is you are involved in what is happening, and non-participant is that you are more standing back. They're not completely mutually exclusive. You might be in a hospital and you might be able to, say, pass someone a sheet, but you can't help someone do some nursing work because maybe you don't have insurance to be covered for that when you're in that setting. So it's important to know what you can and can't do, and you have to try and negotiate that when you're in an environment doing ethnography. In addition, those observations are like the hallmark, but in addition, you can also use interviews, documents. You might look at policies that are guiding practices in a hospital or in the community. You might speak to people as well, but you're using all of those things and kind of funneling them into, say, how do we understand this culture? So an example of health ethnography, and one of my all-time favorite studies ever, was Davina Allen looking at how hospital work is organized. And she found that actually there's this whole other element of nursing work that is not considered nursing work and is often not even valued as being skilled and difficult, but it is. So she discovered the concept of organizational labor. So this is taking phone calls, this is documentation, this is networking with other professionals, answering patient questions. All of these things, nurses reported that they were kind of getting in the way of their regular work. But actually, all of this helped a person move through the healthcare system. So they are examples of real work. So I highly suggest a Google of that study because it is absolutely incredible. So the culture that this study looked at was one in a hospital, but the genius of this was that it was something that is in plain sight, but we take for granted all the time. So that's another really amazing quality of ethnography is you can look at something that might happen every day, and from there make new interpretations that people don't normally consider. I once saw an ethnography of horn honking behaviors in downtown Lima in Peru, I think, or it was like horn honking behaviors among drivers. And so, honking your horn while you're driving a car might seem like a pretty straightforward thing, but this author was able to come with all kinds of insights about the significance of horn honking. And so it's about taking something that might seem every day, but showing how it actually tells us more about the human condition and about our society. So we've got phenomenology, looking at experience. Grounded theory is looking at process. Ethnography is looking at culture. And now we have case studies, which unsurprisingly look at a case, a specific example of something. So they want to get through that phenomenon and understand what that case is in a real world context. So case studies are really effective when you have something that sort of has a fence around it. So for example, experiencing a natural disaster is a great example of a case. It is involved, lots of other people are involved, lots of different things are going on. but it is generally around like one event or one like date in the calendar. And you can look at then like the ripples out of that. How did that affect everyone in an organization, for example? So you generally look at an event or an occurrence and really kind of unravel the threads to understand what is the core of that and what is going on. So you do describe what happens, but you don't only describe what happens. You explain how or why something happened. And these are often longitudinal, which means they occur over a period of time. So for example, you may interview people as something is happening and then go back 6 months later and then go back a year later and say, how have things changed? You know, at the time you felt this, but now that it's a year out, you know, how have your perceptions changed? Or how have things in the organization been different? Those types of things. So looking at something like a natural disaster, you can go back a year later and say, have people rebuilt? You know, what did the community health clinics look like now? What did they look like before? How's the nurse's scope of practice changed? All of those types of factors. So with this, you have various types of data collection. You can kind of tailor what you need depending on the case that you're looking at, but you generally want to like really get inside something that's happened. So this example is a case study of what it is like to work night shift, an experience that just about every nurse has at some point. So looking at what is the case being night shift nursing at this organization, what is that like? And so this study found that there were various impacts on people's lives. They operated almost in a vacuum with little management or education support because they were working, you know, 7 to 7 evenings. Management existed 9 to 5, Monday to Friday, so they never overlapped. People experienced chronic fatigue, and they generally felt invisible in the hospital, but also in some cases in society, because they felt that they worked in this liminal space that sort of exists around when the rest of society functions, that kind of Monday to Friday, 9 to 5 time. So this is a great example of how a case can be kind of one experience, but then still have lots of different elements to it. So a case study is explaining our example. We're really understanding kind of the essence of when something happens. Ethnography is culture, grounded theory is process, phenomenology is experience. You may be tired of hearing this, but this is integral to understanding qualitative research. So this brings us to our last one, which is interpretive description. And interpretive description does exactly what it says on the can. It interprets and describes. So it is a way of understanding what is happening and how can we use this to inform our next steps. So you basically build an analytic framework. So interpretive description came from Sally Thorne, who's a professor in Canada and eminent researcher here, and she saw that there was a bit of a missing piece in our research complement for nurses doing qualitative work. And interpretive description began as a way to solve clinical problems. And she specifically designed interpretive description to be very flexible and to build on nurses' prior knowledge and expertise. So to say, you don't have to start the study as a blank slate. You can start the study saying, you know what, I've worked in this, at this community clinic for 5 years, and we have a problem with this. And so this is my starting point. So she provided something that was much more practical and kind of easy to work with to address clinical problems. It's since scaled up a bit, but this was very much focused on like, how do we work with something that is a really concrete challenge. So interpretive description uses theoretical sampling. It's not the only methodology that does that, but we talked earlier about sampling. Theoretical sampling is a little bit different because theoretical sampling comes after you've done a chunk of the study. And so that comes when you say, I have already learned A, B, and C, and now I need to learn about D, so now I need to ask different questions. So for example, in my master's, I used theoretical sampling when I learned that debriefing was really important for nurses. So I said, okay, I've talked to my first 4 or 5 participants, and now I know that debriefing is really important. So for the next people I'm going to talk to, I want to make sure that they either have an experience of debriefing, or maybe they've specifically avoided debriefing, and I want to ask them why, like why did they go or why did they avoid it? So this can be seen as like you make it up as you go, but that is absolutely not the case. It's a very novice interpretation. What this is saying is that we use what we're learning and we adjust as we collect data and as we analyze, because we don't want to start with something that's completely rigid and then find out it's not working, but be stuck with it the whole study. So it reflects that what your plans are can adapt and change depending on what you're learning and what's happening around you. So this interpretive description is my PhD. And so part of what I did was an interpretive description of what are nurses' roles and what type of work do they do in the healthcare system. And I found that there were generally 3 different types of work. So there was clinical work, which is perhaps the most obvious work that nurses do. And that work occurs in a clinical setting, however defined. And nurses work directly with patients, but they also do other things that are not related to patient care, and that is a legitimate part of their work as well. Then we have managing work, which is where nurses manage the context of care. So they might be like the unit manager or the service manager. And nurses are the ones who do that work because, for example, physicians move all over the hospital seeing patients, but nurses tend to stay in one geographic area. And so that's why nurses manage the context of that area. They make sure that area has enough towels and that the fridge temperature is checked. And this is something that nurses do that no one else does. So by using this interpretive description methodology, I was able to pull out this type of work and say, you know what, this is something that nurses are doing that no one is recognizing. And so to make that very clear. The other type of nursing work I found was enabling work. And this is the work that goes through the pipeline. So whether it be research, leadership, education, policies, any professional regulation, anything along those lines. And some people would say, well, those aren't real nurses anymore, like the quote that we had earlier in this presentation. But actually, that work maintains nursing as a profession. So that's what separates, nursing from like kind people who want to help others, is that we have that professional structure, and that's where the enabling work comes in. So I was able to create a new understanding of what it is that nurses do by looking at the experiences and having discussions with nurses and using my clinical expertise and managerial expertise and saying, what is it that's really happening in those systems? So this is an example of creating a framework, and this is how we get that analytic framework from interpretive description. So here is our summary. This would be the most important slide, and really this is some of the only notes you need for this presentation. But in looking at our goals of having recognition of what the different types of methodologies are for qualitative work, and then how they compare with one another, I encourage you to spend some time with this slide and try and make sure that you understand at least the first 2 columns and, phenomenology studies experience. And if you can get grounded theory studies process, if you can get those things, everything else is the type of material that you can look up or you can reference, but being able to look at a qualitative study and say, this is what kind of qualitative study this is, then that enables you to say, okay, so I expect, you know, this is an ethnography, I expect observations. This is phenomenology, I expect interviews. This is a symphony, I expect violins. And that creates like a shorthand in your mind that helps you to more effectively appraise research as you're going through it. So this has been our introduction to qualitative research. If you have any questions, feel free to be in touch. I know there's a lot of information here and it's very dense, but hopefully going back and going through some of those sections again as you may need to, you can help work out kind of what are those broad categories, how are they distinct from one another, and what are some of the general principles that we use in all of those different kinds of research. So be in touch if you have any questions, and thank you very much.